Hello guys, welcome back to the Dreams of Anatomy Knowledge. Today we're dealing with the elbow joint. The elbow joint is a joint between the lower end of the humerus and the upper ends of the radius and ulnar. What type of joint is the elbow joint? The elbow joint is a synovial joint of hinge variety, and the articular surfaces that form the elbow joint are usually the upper articular surface formed by capitulum and the trochleus of the lower end of the humerus, while the lower articular surface is formed by the upper surface of the trochlear notch of the ulnar. This is a diagram illustrating elbow joints. And this is the humerus, this is the trochleus, this is the trochlear notch, and this is the radial notch, this is the ulnar, this is the ulnar supinator fossa, and this is the quadrate ligament, this is the radius, this is the superior radioulnar articulation, and this is the humeroradial articulation, and then this is the capitulum. Let's go to the next outline. The stability factors that make the elbow joint stable are: the first one, the pulley shaped trochleus of humerus fits properly into jaw-like notch of ulnar. That's this. This trochleus fits exactly into this notch, and that makes the elbow joint kind of stable. And then the strong ulnar and radial collateral ligaments. This is the ulnar collateral ligament, and this is the radial collateral ligament. This line here is the radial collateral ligament, it's lateral, and then this is ulnar collateral ligament, which is what? Medial. Let's go to the blood supply. The blood supply to the elbow joint is usually by elbow anastomosis. Remember, the brachial artery splits into the radial and ulnar artery. Those arteries contribute to the elbow anastomosis. Let's go to the nerve supply. The nerve supply of the elbow joint is brought about by the following nerves: the radial nerve, ulnar nerve, and then the musculocutaneous nerve and median nerve. The movements that the elbow joints undergo are flexion and extension. The flexion is brought about mainly by brachialis muscle, then biceps brachii before brachioradialis muscle. And then we have the extension is by triceps, the muscle of the posterior compartment of the arm, and then the ankle is which is also a muscle of the posterior compartment of the arm. What are the clinical correlates of this elbow joint? Student's elbow, whereby the student puts the hand on the chin and compresses the bursa at the elbow, and you have bursitis kind of student's elbow. And we have golfer's elbow. Golfer's elbow is a kind of medial epicondylitis whereby the medial epicondyl is inflamed. It's also called what? Medial epicondylitis. So this is all about the elbow joints. Please, if you love subscribe, hit the subscribe button and share. Thank you very much for listening.